Hello everyone, this is Kay from Metro Assist and welcome back to another catch-up session. Today I have a very special guest with me and I'm honored that he agreed to do this short interview with me here on Parenting Information Circle. Dr. Alrubaie, welcome. Would you like to introduce yourself?
Okay, thanks. Okay, thanks for the invitation. I'm Dr. Ahmad Alrubaie. I am a consultant gastroenterologist and an associate professor at the University of New South Wales.
Fantastic. Thank you so much for agreeing to do this interview, Doctor. I know you're a very busy man, so we do appreciate giving us some time to ask some of these questions. So today, Dr. Alrubaie will be talking about COVID-19, and we'll be answering some of the reoccurring questions around COVID-19 vaccination among communities. So, since the beginning of the lockdown, Metro Assist has been doing our bit in spreading awareness around COVID-19 vaccination and the importance of getting vaccinated. We understand that a lot of people are struggling during this challenging time, mentally, physically, financially. It's been tough. And, on top of this, people are getting bombarded with various information about COVID-19 vaccines from the news, from the social media, and it can be very overwhelming. And, some people might not be able to, distinguish what's real, what's fake, and so it is great to have a medical professional here to answer some of the burning questions which we might have. So thank you, Doctor. So before we jump into the first quick questions regarding COVID-19 vaccines, Doctor, could you explain what COVID-19 is and what it means to have this virus? Because I know that this Delta variant is slightly different to the Alpha variant, which we had last year.
Right. Look, COVID-19 is the disease which is caused by the coronavirus. Coronavirus is a member of a big family of viruses called the corona family. It can infect both animals and human beings. Out of them, there are by now 7 which can infect human being. Out of those 7, there are 4 which causes the common cold, the simple common cold. And there are 3. The first one causes a pandemic in China in 2002. We call it SARS-1. And the second one causes a smaller epidemic in the Middle East, in Saudi Arabia in 2012. We call it the MERS. The third one is the coronavirus, which is causing the current pandemic, which started in China, in Wuhan province, in late 2019. That's why it's called COVID-19. Now, the initial version of the virus, of the coronavirus, which appeared in Wuhan and then spread all over the world from there, caused the initial phase of this pandemic. But toward the end of the last year, even before 1 full year, we started to get the variants, which are the same coronavirus undergone mutation. The mutation is part of the natural history of the growth and the multiplication of the virus. And we ended with at least 12 of those variants. The worst one is the Delta. So COVID-19 last year, we know that the majority of cases, about 80+%, were just simple flu-like illness. 15% were of moderate cases, and only 5% of the cases were severe one, which might require intensive care admission. And among them, there is the death in the disease. Now, with the Delta virus, we get a virus which is first much more contagious than the original coronavirus from last year. And that's why it starts to affect even young people. Young people which were spared and rarely affected by the initial version. Now the wave involving a large number of them, And in fact, around 70% of the cases are less than 40 years old, and about more than half are less than the 30 years. So that's the first difference. The second difference is that Delta virus is causing a much more severe cases, which end into hospitalization, intensive care admission, and death. So these are the two main differences between the current Delta. That's why we start see much more cases there. And among the severity, in fact, it's more than 5% have a severe cases. And among them, we start to see even young people, some teenagers, some people in their 20s and their 30s. They are lying now in the intensive care unit with a severe disease of the COVID-19. So this is COVID-19.
Right. Okay. Thank you, Doctor. So with the government encouraging people to get vaccinated, is this the right way to go? Why should we get vaccinated, and what are the benefits of getting vaccinated?
Excellent. Now, we consider coronavirus as a deadly virus because the death rate with this virus from the beginning was around 2%. So 2 out of every 100 patients with COVID-19 end with death. And this rate continued over almost the last year, in spite of all the lockdown, in spite of all the closing the borders, in spite of developing good medication to treat the severe cases. In spite of that, the number of cases continue to proliferate and increase, and the number of deaths continue the same. So vaccines are the only available protection against, first of all, the spread of the disease, and secondly, the severe cases which end with death or admission to intensive care with the bad consequences, even without death. All right? That's why we need to vaccinate ourselves. First, to protect ourselves, and by this protection, we can protect our kids, families, friends, relatives, and the community. Because if this infection continue, we will get more and more of the bad strains, bad variants like the Delta. 6 months later, we might get a strain or a variant which is worse than Delta. That's what happened. Delta is worse than the original one. Now we might have a strain or a variant which is worse than Delta. So the sooner we have our vaccines, the better in preventing these bad variants on one side, prevent ourselves from going to hospital, admitted, having bad consequences of the COVID-19, having death with all these things. That's why we need it. It is the only medicine available to have this protected, guaranteed. It is guaranteed. It is effective. This is not talking about 1,000, 10,000, 100,000 patients. We talk about billions of people receiving the vaccine so far. 5.6 billion doses were used so far. And the number of people who have 2 doses there worldwide, 2.6 billion. 2.6 billion, not million, billion. So all these people used the vaccine, and it was effective in decreasing the admission to hospital, decreasing the bad cases, the severe cases, and decreasing the number of deaths. The people who are vaccinated have less risk of going to hospital by more than 10 times. They die less by 10 times compared with the unvaccinated. So vaccines are very important, very essential. And in fact, there are no other medicine or measure which can help us to fight against this virus.
Definitely, Doctor. Yeah, I agree that it is important that people who can get vaccinated because you're not only protecting yourself, but you're also protecting the vulnerable community out there who are unable to get vaccinated as well. So that's fantastic. Thank you. Yep.
Can I just mention in addition that the number of total deaths now worldwide is more than 4.5 million. So there are deaths more than 4.5 billion, and this is on the increase. So we're not dealing with the flu or with a simple infection. We're dealing with a deadly virus there, and this rate can keep increasing there, which is a huge rate. It is a huge losses there among our human beings.
Definitely. I think there's a lot of misunderstanding with, especially among the younger generation, that this is just a cold and that we can get over it. I've seen a lot of, people typing away on Facebook saying that, oh, it's just a cold, we don't need to get vaccinated, but this is not the case with the Delta variant. So if we do choose to get vaccinated, Doctor, what are the symptoms that we can see after getting vaccinated?
Now, well, look, generally speaking, the majority of people have no symptoms apart from the little prick of the jab there. The majority, among them was myself. I had my vaccine. I returned back to my work, to the hospital, and the next day I worked the normal day. So the majority of people, they do have nothing, no symptoms. Now, there are more than 1/3 of the people, they might have some simple symptoms, including a pain and tenderness at the site of the jab, including little fever, not high fever, including myalgia, some muscle pain, some joint pain, a bit of feeling unwell, some drop in the appetite. This lasts, it looks like simple flu, lasts for 2 to 3 days. There are some cases which these symptoms can extend up to a week with some fever, maybe more of the feeling unwell. But all these symptoms, first of all, are transient. They disappear without any consequences, and they respond well to simple measures like a painkiller, for example, excessive fluids and rest. Rarely we need any active treatment for this vast majority of the side effects. Now, the serious side effects are extremely rare, extremely rare. There are some serious side effects of the vaccination, but these are extremely rare. Of them, there is the clotting serious side effect, which is linked to AstraZeneca. And there is also the inflammation of the heart muscle and cover, the myocarditis and pericarditis, which is linked to the Pfizer and Moderna, because they are very close to each other. So these are the most serious side effects, but these are extremely rare, extremely rare. That, for example, the clotting in AstraZeneca occur in about 6 out of each million. And the inflammation of the heart muscle in the Pfizer, particularly in young people, occur in a very small number out of each million. These are very rare. We talk about less than 30 in each million, and these are simple ones, although they look like serious side effects, but they are reversible and they don't cause any serious consequences. The clotting, and we can talk more in details about it, it can cause some serious complications, but the death is extremely, extremely rare, and it is less than the death in the COVID by 100 times.
Right. And to those who are interested in learning about, AstraZeneca and the effects of AstraZeneca, we will be talking about this in our next session. But yeah, thank you, Doctor. So moving on to the last question, which pops up a lot since the vaccine is developed in a very short amount of time. How can we be sure it's safe for people to get it?
Well, this is a very good question because people, apart from the deliberate questioning of the virus by the anti-vax groups there, a lot of people, they know that vaccine might take anything between 2 years and 5 years for the full production and marketing. All right, but this vaccine, the vaccines in general for the COVID-19 were produced within less than a year. So it is a condensed period, which is a shortened period, but this wasn't on the expense of the scientific standards for any trial, for any testing there. The first factor is that this is the first time in history where all our scientists, scientific centers, research centers, universities were focusing on the production of a vaccine for a single virus. This is the first time. So you can imagine there is a collective effort of the whole world centers, scientific and research centers, to produce it. So there's a lot of effort. Two, the financial and the funding support for these vaccines were exceptional because all governments, all the world were after just having the vaccine as soon as possible. So there's a lot of funding, and this is important. Three, under the impact of the pandemic, there were more volunteers joining the 3 phases of the studies for the vaccine. For example, the Pfizer have more than 40,000 volunteers in the last phase 3. Now, in any medicine, couple of thousand to get them, you might need 3-4 years because there are not many people who volunteer to do it. While here, under the pressure of the pandemic, there are many volunteers. So this also helped shortening the period or the time to produce the vaccine. The other important factor is that these experiments were not on a new virus because coronavirus had a lot of relationship with the previous coronavirus, which causing the previous pandemic. More than 80% of the structure of the current coronavirus were already known because they are similar to the coronavirus causing the previous pandemics. That's why there are a lot of data already within the hand of the scientists to use. So for these reasons, all the vaccine didn't take long time. That's one thing. The other thing here, which everyone should be understanding, is that the vaccine after use, there is a continuous checking on its safety and efficacy. And now, after more than 8 months of use, all the data from billions of people use it, confirm the safety and efficacy of that initial study. Now, for Pfizer, the FDA gave the final approval just last month, which indicates that their testing for the last 8 months on billions of people confirmed the same fact for the safety of the vaccine and also for the efficacy.
Right. I see. Yeah. Fantastic. Okay. So that was our last question. Fantastic. And yep, so that was our last question, and I'll end the interview. So thank you, Doctor. That was very informative. I'm sure a lot of our members would appreciate this video, and hopefully it will give them the information that they needed to make an informed decision to whether to get vaccinated or not. To the viewers, please consult with your local GP regarding vaccination first before booking an appointment to get the jab. And also, if I have missed out on any questions you wanted me to ask Dr. Alrubaie, please drop them in the comment section below, and we will go through them in our next session. Thank you, Doctor.
Okay, thank you very much. Take care.